Yeah, this was named the HOPE trial, and the HOPE trial was a multicentric prospective randomized trial with open label and blinded endpoint that was conducted at 11 stroke centers in Spain from 2021 to 2025. And the main aim of the trial was to test the hypothesis that the reperfusion-guided systolic blood pressure targeted strategy might lead to improved functional outcomes in patients after EVT compared to current clinical guideline recommendations. And so what we did in the trial was to randomize patients who achieved a successful reperfusion after EVT, rather to be allocated to the control arm, that these patients were treated according to current guidelines, or if they were allocated to the intervention group, they were stratified. The systolic BP target ranges were stratified according to the final reperfusion achieved. That was that patients with an incomplete reperfusion, with an MTK2B, had to be in a systolic blood pressure target range between 140 and 160. And patients with a final MTK2C3 after the procedure had to be in a systolic blood pressure target range between 100 and 140. And this was applied over a treatment period of 72 hours, and then we assessed functional outcome at 90 days. And so what we found, the primary efficacy outcome set for the trial was the proportion of patients achieving favorable outcome at 90 days, defined as a score of 0 to 2 in the modified ranking scale. And what we found is that in the control trial group, we found 46.7% of patients achieving favorable functional outcome, and this proportion was greater in the intervention group with a 60.00% of patients, and that was an absolute risk difference towards a benefit of 13% and an odds ratio of 1.71 towards a favorable outcome with intervention. And all these efficacy analyses were statistically significant, so the trial turned to be a positive trial.